Welcome. Today, I'm stepping in as your virtual career counselor. If you're pursuing your Bachelor of Pharmacy, or maybe you've just graduated, you're probably looking at your future feeling a wild mix of total excitement and, let's be honest, deep anxiety. Well, take a breath because you are in exactly the right place. In this explainer, we're going to completely demystify the incredible, wide-ranging post-graduation opportunities waiting for you. We're going to map out exactly where that degree can take you. And spoiler alert, it goes way beyond just memorizing pill names and standing behind a counter.
Okay, let's dive into this. Here is our roadmap for today. We'll start by looking beyond the medical store, then cover essential skills for freshers, explore securing government jobs, step inside the pharma industry, compare M.Pharm versus a pharma MBA, and finally, wrap up by helping you find your perfect path.
All right, Section 1, Beyond the Medical Store. To kick things off, we really need to tackle the single most common source of anxiety that B.Pharm graduates face right out of the gate. There's this super common myth out there that finishing your 4-year degree just gets you a license to open a retail medical store, and, well, that's it. Your career is permanently set behind a single counter. Now, don't get me wrong, running a retail pharmacy is a fantastic and completely valid choice for a lot of people, but it's really just one of many distinct paths. In reality, your degree unlocks vast options across hospitals, highly respected government jobs, massive corporate manufacturing, and cutting-edge research and development. Opening a shop is a choice. It is absolutely not your only choice.
So, is a medical store your only choice? I want you to completely reevaluate your mindset right now, because even if you absolutely love the idea of running a pharmacy, you could upgrade your ambitions to a hospital pharmacy. Think about it. Instead of a standard retail setup, you're directly integrated into a fast-paced healthcare facility. You're collaborating closely with doctors and nurses, handling specialized medical devices like drips and cannulas, and ensuring the safe, rational use of really complex medicines. The scope here is just so much larger than that old myth suggests.
Moving right along to Section 2, Essential Skills for Freshers. Because, knowing these career paths exist is one thing, but how do you actually step onto them and get hired?
Well, here is my core counselor advice to you today. Education makes you a graduate, but skills make you employed. Having good academic marks is great, for sure. It proves you can study. But when you're sitting across from a hiring manager, a degree just makes you a graduate on paper. Standing out requires actual, practical expertise on your CV. You need something that clearly tells the employer, hey, I am ready to work on day one.
The good news? You don't need to master everything. But mastering just one high-demand technical skill can completely change your trajectory. For example, if you can confidently operate HPLC machines to separate chemical compounds, use UV spectroscopy to analyze substances, or even bring modern skills like AI tools and programming languages into a traditional lab setting, wow, you instantly become job-ready. Having literally just one specialized skill on your resume separates you from the crowd, and honestly, it can unlock significantly higher starting pay.
Let's jump into Section 3, Securing Government Jobs. For a lot of us, the ultimate goal is a career with total job stability, deep respect in the community, and excellent benefits.
Getting into the government sector requires intense, dedicated preparation. It's definitely not an overnight process. First up, you absolutely must register as a state pharmacist. You literally cannot bypass this step. Second, you've got to prepare for some really fierce competitive exams. You need a competitive edge here, which means utilizing specialized materials. Resources like the GPAT punchbook or targeted study materials and live classes from Pharmacy India are excellent tools to build that exact edge. Only after doing that are you ready for Step 3, applying for those highly sought-after state and central vacancies.
And let me tell you, the rewards for all that hard prep are massive. You could become a drug inspector. That is a role with immense authority. We're talking the power to grant or withdraw medical store licenses across an entire state. Or you could secure a really stable position as a railway pharmacist, or work in prestigious institutions like Ames, or as an ESIC pharmacist. The vacancies for these hospital roles pop up pretty frequently, and they offer incredible job security and immense social respect.
All right, Section 4, Inside the Pharma Industry. What if you want to jump straight into the fast-paced corporate workforce without doing higher studies or waiting around for those tricky government exams?
The factory floor can honestly seem a bit intimidating at first, but it's not just one giant, chaotic room. It's highly structured. If you like hands-on, large-scale work, the production department is where bulk drugs are actually manufactured. If you're more analytical and detail-oriented, quality control is where you rigorously test those products to ensure patient safety. Or pay. If you prefer strict paperwork over lab testing, quality assurance handles the critical documentation and compliance that keeps the entire company running legally. There is a specific department out there perfectly tailored for your unique working style.
Now, here's a bit of a reality check I have to give you as your counselor. As a fresher, your starting salary as a trainee in production might be, well, quite low. Don't panic. And more importantly, don't reject the job just because of that first paycheck. Seriously, the rapid growth and practical, hands-on experience you gain in that first year are incredibly valuable. Once you actually know how a massive manufacturing plant operates from the inside, your value in the industry absolutely skyrockets.
Alternatively, if you're highly extroverted, confident, and you love to travel, the medical representative, or MR path, is incredibly lucrative. You are essentially the vital communication bridge between the pharma company and the doctors. And just look at this rapid, field-based career growth. You start as an MR, but within a few years you can move up to senior MR, then an area manager, and eventually a zonal manager. It's a fantastic blend of solid science and high-level sales.
Next up, Section 5, M.Pharm versus Pharma MBA. Some of you out there might want to level up your qualifications and enter the job market at a much higher tier right out of the gate.
You basically have a fork in the road here, and you need to carefully weigh your master's options side by side. If your true passion lies in clinical science, lab work, or academics, an M.Pharm is totally for you. Specializations like pharmaceutics or pharmacology lead directly into research and development or even becoming a college professor. On the other hand, if you're drawn to business strategy, an MBA in pharma or hospital management is your golden ticket. It shifts you away from the lab bench and drops you directly into corporate marketing, project management, and corporate leadership.
So, the crucial point here is that if you want to pursue an M.Pharm at a top-tier institute like DIPSAR, or if you want access to government scholarships and future PhD preferences, you absolutely need to conquer the GPAT exam. As your counselor, my biggest piece of advice is do not wait until graduation. You should really start preparing for the GPAT in your second or third year. Think about it. It uses the exact same syllabus you're already studying, just with a highly competitive edge.
Finally, Section 6, Finding Your Perfect Path. We've covered a tremendous amount of ground today. Let's bring all these diverse options together into a focused perspective as we wrap up this counseling session.
Before you make your choice, I want to drop in 2 more highly in-demand, globally recognized corporate roles. If you want to blend pharmacy with a modern office lifestyle, definitely look into clinical research. That's where you handle data management and support for live human clinical trials. Or consider pharmacovigilance. This is an incredibly fast-growing global sector where you monitor post-market drug safety and track adverse reactions to protect patients worldwide. These are just fantastic, high-growth corporate avenues. So, which path will you choose today? I think we've shattered the myth, right? A retail medical store is a great option, but as you've seen, it's just the tip of the iceberg. From government prestige to corporate leadership, all the way to the cutting edge of clinical trials, the options are vast, but the choice is entirely yours. You just need to identify where your true interest lies. What path genuinely excites you right now? Figure that out, start building that one crucial skill we talked about, and take your first bold step toward a fulfilling career today. Thanks for joining this explainer, and I'll catch you in the next one.